So before I begin, I want to iterate tremendous support of my colleagues, Dr. Uchino, and co-authors, Dr. Faris Antaki, who's also with the Cleveland Clinic. The issue I have is, as a stroke neurologist at 2 a.m., I have to open the chart of a patient I don't know about and quickly review to see if this patient is eligible for stroke thrombolysis. This is, of course, when I'm on call and there is an acute stroke that is suspected in the ER somewhere. The issue is, as a human who reviews a chart at 2 a.m., I can make mistakes. I sometimes misses an important fact. Let's say this patient has an aneurysm or has had bleeding in the stomach recently, or on certain blood thinners, for instance. And even if I'm perfectly accurate, it is very possible that I may take 2, 3, 4, even 5 minutes to review the chart to make sure I absolutely do not miss anything. And of course, that takes time. And we know in strokes that every second matters when it comes to saving those brain cells from devastating stroke. So what we imagine is, what if we use something like ChatGPT, which is a large language model that can scan a large chunk of text within the electronic health records very quickly, far more accurately than what any human can reasonably do. What if that is a tool that can meaningfully assist in our current acute stroke workflow? So we build an app. We took 30 notes from patients from our cohort, which I'll explain in a second. But let's say for a given patient, we take their most recent 30 notes, 30 clinical notes, and then we design a custom proprietary prompt for our large language model, which is, in this case, we use ChatGPT, and we just run it through ChatGPT, and the ChatGPT will tell us if the patient has, yes or no, a contraindication. Let's say patient has a GI bleed. When 5 days ago, you can find the actual text in this little excerpt, so you can verify there's the date and the author of the note, so you can find the source note itself. And we aim to, once we design this app, this structure, we set out to validate if this is actually accurate and fast, which it was. So we used 388 patients. This is all the patients that came through a random month that we selected through our Cleveland Clinic, either our main campus or one of our 16 sites. So we have a lot of smaller hospitals. But we all share a common electronic health record. So out of these 388 patients, we run through the pipeline I just mentioned, and we took 2 neurologists to go through each chart. Now, they don't know anything about ChatGPT. They just go through the chart, about 30 minutes for each chart, right? Really thoroughly, much more thoroughly than you would afford in a real case scenario, to really make sure that every contraindication is identified. And then we wanted to have 2 physicians doing that independently. So we really don't want to miss anything. And then they compare their answers, and maybe one have missed, the other have not. And they come up with this final kind of answer sheet, right? This is as good as it gets in terms of a gold standard in terms of the answer sheet. And then we compare what the ChatGPT says about these patients against what these 2 independent human reviewers have found. And what we found is a sensitivity of 95%. So just a bit of background, among these 388 patients, most of them, I would say about 75, 80% of them don't have any contraindications. So they're fine. And that's something we expect. Now, a minority of patients, they do have either 1, 2, or sometimes even 3 contraindications. And if you take the total of all these contraindications among this pool of patients, there are about, if I remember correctly, about roughly 100 contraindications, and ChatGPT missed 5. So the sensitivity is 95%. The sensitivity is 95%. And then there is going to be false positive, of course. If ChatGPT says something and then we're like, it's not in our answer sheet, so that's a false positive, right? So we come across about 1 in 2 things that ChatGPT says that is a false positive. Now, because of the way we design, right, you can verify with the node, it has the actual excerpt. As a human, it takes seconds to verify and realize, oh, this is probably a false positive. Thanks for letting me know. Of course, ChatGPT wants to be overly safe, then sorry. But I'll disregard that. So that's where the human element comes in. And in terms of a negative predictive value, so if ChatGPT says the patient has no contraindication, you're okay to give thrombolysis, if everything else checks out, what is the probability that there is something missed? It's about 1%. So 99% of patient that ChatGPT says you're fine to give truly do not have any contraindication in the chart. So that is fantastic. And as for cost and how long does it take? So it takes about 14 seconds for ChatGPT to analyze. Now that doesn't consider the amount of time that we need to first extract the chart and then all the user interface stuff. It's about 30 seconds on average, which is very, very fast. And it cost, if I remember correctly, less than 10 cents. I believe it was something around 7 cents. And we kind of did the math, like how much it will cost us over one whole year. And that's Cleveland Clinic, which is a huge hospital. We cover 16 different hospitals, less than $500 US dollars, which is very, very cheap. And I think is going to be very cost effective. And our next step is going to try to design a trial that's going to compare people who use this AI tool and those who do not, to see if it impacts on the safety, impact on the speed of treatment delivery, and patient outcome. And the app, right, we give it a name. We haven't trademarked it, so please don't use it. But we are calling it NeuroGlimpse, because it's a collaboration between an ophthalmologist and myself as a neurologist, and it's a glimpse into the chart, into the patient's brain, and hopefully that will make stroke treatment a lot safer and faster and better for the provider and for the patient.